I am Dr. Advani, a senior oncologist at Raheja Hospital. I have been in this field for last 45 years, and today I am very happy to discuss with all of you as to how not only the cancer patient himself but also his caregivers can really give a support to the patient in order to improve the outcome. The outcome of the cancer depends upon, of course, on the diagnosis as well as on the treatment which is given. But these are very standard. However, all these outcomes are modulated by the support the patient receives from his surroundings, from his caregivers, from his friends, from his family members in and around him. The most important thing while the patient is undergoing the treatment is the uncertainty of the results. However, it is the people around him, the caregivers, which can give him the full confidence to go through whole treatment very successfully. First and the foremost thing, that there are many myths about the cancer treatment. We see so many of our patients who are limited in terms of what to eat and what not to eat. And these limitations are put to the patient not from the doctors but from the social media, transferred to the patient through the relatives. Every relative which comes and visits the patient puts one restriction. All of us know that the food is very important while the patient is undergoing treatment. He needs a good food. He needs a good tasty food. He does not need a very raw, bland diet. In fact, I would encourage the patient, eat everything as long as it is hygienic. The emphasis is on hygiene, not on what are the things that you are eating. Food can hardly do any harm to the patient. So family members have to make sure that the patient receives the most tasty food in order that he or she will eat the full food, a full diet. The second most important thing which is really necessary for the patient is to get the encouragement, and I think this is very important. Patient has also lot of negative thoughts coming to his mind. Relatives have also the negative thoughts coming to their mind, and if you interact your negative feelings to the patient will get more negative. And that's where, unless the relatives, the family members, they become positive in their thoughts, positive in their approach, they can convert the negative thoughts from the patient to the positive thoughts, and that's where he can fight with the disease much better. He will eat much better with this, and he will feel more confidence, and then he knows that with the help of everybody around him he will be able to get out of this disease. And I think these few things are very important. Of course, the other things also play an important role, is to make sure that the patient should be engaged all the time. He should receive, of course, good rest, he should receive a good sleep, but he should be engaged. You cannot give the empty mind. Make sure that he is engaged, whether some work or play, indoor play, outdoor play, whatever is possible, he should be engaged, and that's how he can keep his mind positive. So, ladies and gentlemen, I am sure These few words will help you to help the patient as a caregiver to go through this time. At the same time, I must admit that caregivers also have to take care of themselves. Caregivers have an important duty, and duty has to be done, and that's where they have to keep themselves also strong, positive, confident and knowledgeable, so that they can contribute these things with the patient. Thank you.